So let's talk about what the Blair technique is. The Blair procedure is all focused on the upper cervical spine, and the upper cervical spine, more specifically the atlas, which is the first cervical vertebra. The second cervical vertebra is called the axis, and then you have the head resting on C1. The average person's head weighs 10 to 12 pounds. It's sitting on this poor little bone that weighs 2 ounces, and the joint on the right and the joint on the left is bearing the weight of the head. So the junction between the head and the neck is the most vulnerable area to injury, and as a result, as people go through life, whether it's a car accident, they get dropped on their head, they take a soccer ball on the head, they dive off their diving board and hit their head on the bottom of the pool, those types of blunt head traumas can cause this most critical junction to misalign off the floor of the skull, and that atlas can become locked out of position. And when it becomes locked out of position, it interferes with this most vital area in the body, this red area called the brain stem. So from a musculoskeletal standpoint, because all the postural muscle tone in the body is controlled by the brain stem here, it causes the structure of the body to be out of balance. So most typically what we see is the head off center to one side, one shoulder higher than the other, one side of the pelvis higher than the other, one leg shorter than the other. And this is the global imbalance in the postural muscle tone, which is all originating here in the upper neck. So basically what we do with the Blair technique, we run the patient through a battery of neurological findings to determine whether they've had a prior neck injury. And if they have, then we take very precise imaging that looks at the joints of the neck. So there's, like I said, there's 2 joints on the bottom of the head, there's 2 joints on the top of the atlas, and where those 2 joints match together, they fit perfectly. They're perfect mirror images. So if you have that segment that's locked out of position, and we take very precise x-rays that look at the skull joint and the C1 joint, how they match, we can see these outer margins of the joints, whether they're lined up, whether it's misaligned, and we can measure how much, or it's misaligned under, and again, we can measure how much, and we can measure the angulation of the joint. So basically what we're doing is we're finding out where you're misaligned. We take imaging to find how you're misaligned, and then the information off of the imaging is used to make a very precise correction in a neutral position. The patient's lying on their side. There's no twisting, there's no popping, there's no pulling, and the goal of the care is to get that segment that's locked back under the body's control to get rid of the mechanical pressure on the cord to allow the central nervous system to function better. Now, in doing so, all sorts of different conditions that people come into our office with that typically have been from doctor to doctor to doctor and have been treated from a symptomatic approach, right? If you have headaches, you don't have headaches because you have a lack of Advil in your body, and if you have back pain, it's most typically not because you have a lack of a muscle relaxer in your body, it's because something's not functioning right. So to put it all in a nutshell, our goal is to increase function in the body, and I'll leave you with this. Nature needs no help, just no interference. Our job is to remove the interference and allow the body to function the way that it was intended to.